Hello everybody. It is Saturday morning. It's early. I apologize not getting this update out last night as I usually do on a Friday. It's been a very long and busy week, and I was very busy yesterday and a long night. I went in very early due to the windstorm that we had throughout the county yesterday. Fortunately, we didn't get the snow. That was the possibility, but the wind did come, and then several trees went down throughout the county, and we worked early and we worked late. So I apologize for that, but I am here today. Saturday the 20th, the first day of spring. It looks like it's going to be nice out today. So everybody, please enjoy. Do what you got to do, get some fresh air, and we'll go from there. But let's get right into it. County statistics: active cases are 1,243 countywide. Hospitalizations of those 1,243 are now at 48 in the hospital. Unfortunately, our fatalities has climbed to 419. The county is now at a 4.39% infection rate over the last 7 days, and our town of Dover has gone up a little bit to a total of 17 active cases. We knew some things. People are getting out. Things are opening up. A little number increase is expected, but we hope to maintain. We hope to go downward from here. So, county updates. The county has formed what they're calling the County Vaccine Outreach Coalition. Dutchess County Vaccine Outreach Coalition held its first meeting on the 9th, Tuesday. County Executive Molinaro assembled this group to help get out information to ensure the public has knowledge of the importance of receiving the COVID-19 vaccine and how the distribution system works. We all know you need to get registered. You need to wait for that update. You need to wait for that invite link to get in, and then you need to answer it. Be available. If they call you and you want the shot, make yourself available, please. The goal of this diverse group of community leaders, county officials, is to provide accurate, up-to-date information about the vaccination process. The coalition will focus on hard-to-reach populations and dispel the myths about the vaccine through conversations with both individuals and organizations, and by distributing the provided information by the Dutchess County Department of Health, the Behavioral and Community Health, and other reputable health agencies and sources. Dutchess County's goal is to vaccinate as many residents as possible, as many that are as willing to take it. We want to put the shots in the arms to reach a great enough vaccination rate to provide the immunity necessary to keep Dutchess County as healthy and as safe as possible. That is the goal. As for the vaccine, as the vaccine becomes more widely available in the weeks and months ahead, this group will make a significant difference. The county executive reminded residents that as the state continues to open the eligibility, vaccinations are still limited, as patients will be required as the distribution process continues. As they keep opening the eligibility, there is still a supply and demand issue. So that 40 to 50 to 60,000 people that are still eligible, if they open it up, that number will stay the same. It won't go down for a while. Supply and demand. But we're making headway. You'll hear some numbers here in a minute. The county encourages residents to complete the vaccination information request form for residents to receive a notification when a vaccine appointment is available based on eligibility. Those who sign up will also receive updates about vaccine availability at other providers around Dutchess County, including the hospitals, the medical practices that participate, and the pharmacies. The form is available on the county's vaccine information page. Remember, DutchessNY.gov homepage. Look across the top. I believe it's the second one in. Vaccine information. Click on it. Once that opens, you'll see Register Me or registration form. Click on that. Start entering your information. That's all you need to do. Dutchess County Executive Mark Molinaro hosted his most recent online town hall forum. He goes live every Wednesday. All right, you can type in questions. You can call in questions. Ask him. He will answer. Dutchess County vaccine metrics as of the 15th of March, this past week. Over 70,000 Dutchess residents with at least one dose of vaccine has received it. Over 32,000 residents in Dutchess County have received the second dose, which means 24.5% of the residents in the Dutchess County have received the shot. Over 10% has completed the second shot. So we're getting there. It's not where we want it to be, but we're getting there, okay? This week, 3,200 doses only of COVID-19 vaccine has been allocated to all of the providers throughout Dutchess County by the State Department of Health. Dutchess County Department of Behavioral and Community Health, our health department, is slated only to receive 1,500 of those of Moderna and only 500 doses of the Johnson & Johnson from New York State to vaccinate eligible groups at the county's Poughkeepsie and Dover pod sites. Point of dispensing. By appointment only, remember. Additionally, the county continues to host some pop-up visit vaccination sites with upcoming sites in Beacon next week, followed by sites in Pine Plains and Hyde Park. Remember to look for those updates. Check them frequently, each and every day, throughout the day. Dutchess County also continues to partner with area primary care providers to vaccinate homebound and medically frail senior citizens. Additional doses have been allocated by New York State to hospitals and pharmacies in Dutchess County. Updates about these vaccine allocations are posted again at the dutchessny.gov/COVID vaccine. Please check your updates each and every day. I cannot say that enough. Last week, the New York State has announced new eligible priority groups. Those who are now 60 and older. Remember, it was 65. Now it's down to 60 and older are now eligible. Public-facing government and public employees. Nonprofit workers who provide public-facing services. Essential in-person public-facing building service workers. The state also announced all vaccine providers can vaccinate any eligible group beginning this week except for the pharmacies, okay, which are still required to prioritize those who are 60 and older, but will be able to vaccinate teachers per the federal guidance. The county's Vaccine Outreach Coalition held its first meeting, as I stated earlier, to ensure equitable distribution of vaccine doses throughout the county. And thanks to a coalition with libraries, residents can now call any library in Dutchess County for assistance with signing up for the county's vaccination information form. If you need help, remember, you can call our rec department. You can call our clerk's office, and they will help you out as well. But you can now reach out to your library, and they will help you as per the county. Dutchess County, all libraries in Dutchess County can be used for assistance. Thank you very much. The County Executive Molinaro will now host his next telephone and Facebook Live Town Hall on Wednesday the 24th at 5:30. Okay? There's that part. From our Dutchess BNN, that's our Dutchess Business Notification Network. Remember, we were hearing a lot from them a while ago. They have some updates. This is some gathering updates. Please pay attention. Businesses, residences, any other type of halls or gathering organizations, please pay attention to this. New updates for Thursday, March 11th, 2021. In-person events can increase to 150 beginning March 15th. Responsible parties are required to notify the local health departments 5 days in advance of the event taking place. A form was developed to make it easier for the responsible parties to submit the event information and for the county to receive and share the information. New York State guidance permits some businesses to open more fully. These changes include wedding and event venues and arts and entertainment venues, as well as restaurants to host patrons at a 75% capacity. More will be coming down the road. Gathering regulation updates beginning March 22nd. Residential social gatherings will be increased to allow up to 25 individuals outdoors. Indoor gatherings will remain at a 10-person capacity. These new limits are for gatherings without testing. Non-residential social gatherings will be increased to 100 individuals indoors or 200 individuals outdoors. These new limits are for gatherings without testing. Beginning April 2nd, events, arts, and entertainment venues can now reopen, though guidelines have not yet been released. It has been announced that the venues would be restricted to a 33% capacity or up to 100 people indoors or 200 people outdoors, whichever is lower. With proof of negative COVID test prior to entry, capacity can increase up to 150 people indoors and up to 500 people outdoors. Remember, duchessbnn.gov, okay? You can go to the Duchess BNN website and you can read this as many times as you need to understand it. I know it's confusing. We read it every day, and it's still confusing sometimes. So please, go to the site, read it for yourself. Sign up for vaccine appointment notifications. Go to the sites and register. Please. Please do so. We also have some other dates. Beginning March 15th, as I stated, weddings and catered events can resume statewide. Please follow the guidelines. Beginning March 19th, residents can move up to 75% indoor. The food service guidelines can be found online. Beginning March 26th, indoor family entertainment centers can open limited to 25% capacity. Guidelines have not yet been totally issued. Beginning April 9th, outdoor amusement parks can open to 33% capacity. April 1st, domestic travelers will no longer need to quarantine upon their return. And I have a big update for traveling circumstances. Okay? New York State, if they did not come into contact with an individual who tested positive for COVID-19, I'll read the details here in a second. International travelers as well. So let's go right to the travel update. Sent to us by the state, by the governor's office. With virus rates dropping throughout the country, New York, we will now abandon the mandatory quarantine requirement altogether for those traveling domestically. Through the State Department of Health, we'll still recommend the precautions. So, Governor Cuomo announces quarantine for domestic travel will no longer be required starting April 1st. While no longer required, quarantine after domestic travel is still advised as added precaution. Mandatory quarantine remains in effect for international travelers. All travelers covered must continue to fill out the traveler health form upon arrival into New York State. You no longer have to quarantine, but you still need to fill out the paperwork. Governor Andrew Cuomo today announced that domestic travelers will no longer be required to quarantine after entering New York or any U.S. territory starting the 1st of April. While no longer required, you still are required to fill out the paperwork, as I stated. Mandatory quarantine remains in effect for international travelers. All travelers must continue to fill out the traveler health form. Individuals should continue strict adherence to all safety guidelines to stop the spread, again, by wearing masks, social distancing, and avoiding gatherings when possible. As per Governor Cuomo, everything I just read. Regardless of the quarantine status, all individuals exposed to COVID-19 or returning from travel must continue a daily symptom monitoring through day 14. Continue strict adherence to all recommended non-pharmaceutical interventions, including hand hygiene and the use of face coverings through day 14, even if fully vaccinated. Even if fully vaccinated. If you have come into the contact or exposed to it, you still need to follow it. Must immediately self-isolate if any symptoms develop and contact the local public health authority, as per New York State. A lot of information. Please go to the websites, duchessny.gov, go to your state websites. So as you see, many changes are coming. As case numbers go down, vaccine totals go up, state and county-wide. Travel in a big way, the changes I just read for now, and we hope they stay that way. Gathering type situations, again, if we do it smart and if we do it safe, we should be able to keep it going and get to a normal gathering one day. We continue to put shots in the arms to those who choose to get it. Remember, it is your choice. As those numbers go up, the supply and demand will eventually equal out. We need to continue to be patient. We've been saying it for weeks. Please be patient. Just because you sign up today does not mean you will get a call tomorrow, next week, or in 2 weeks. It may take a little bit. Remember, the names are randomly chosen through a computer process to those groups that are eligible. Now they just expanded the groups. Adds more names, okay? Again, you need to register on every site you can, both state, county, pharmacies, medical facilities, okay? And if you think you don't want it, remember, you got to choose to take the shot. And if you choose to take the shot, then please register. That's all we can say. No walk-ins. They will call you to come and get it. All right, so with that, I leave you with this. Continue to be safe and with everything you do. Protocols, safety. Be smart, be safe when gathering in your groups, but enjoy your family and your friends. As occupancy levels go up, so will the relaxation, so will the fun. As the numbers go up and hopefully stay up, these income numbers go up. Sorry. Good luck. There's a lot to read, and I apologize. Be safe, be smart, relax, enjoy the good weather that's coming. To each and every one of you, I wish you well. I wish you to be safe. And as always, do whatever you can do to stay healthy. We are Dover, we are strong, and we are Dover strong. We are one team, we are one town, we are the town of Dover, and we will always be the town of Dover. Have a great weekend. Enjoy the good weather. God bless, and until next time, good day.